Hello, welcome to the podcast, Breaking Down Lymphoma, where we break down lymphoma into simple terms that everyone can understand. I'm your host, Julie,
And I'm Bailey.
and today, to shed some light on the subject, we have a special guest, Dr. Pokala, who is a pediatric oncologist. So we're going to be interviewing him today, getting some information.
I'm really happy he was able to join us and make some time in his day for us.
Thank you. Honored to be a guest on your show.
Absolutely. Thank you for being here. So, Dr. Pochla, we want to start out by asking you a few questions about lymphoma. So, let's just dive right into it. What made you choose this career and want to become this type of specialist?
So I'm a pediatric hematology oncologist. So I did 3 years of pediatric training and then did another 3 years in pediatric hematology oncology, which is blood diseases and cancers. The most common cancers we see in children are blood cancers, like leukemias and lymphomas. And so that's why kind of blood disorders and cancers have been kind of linked together. I got interested in blood cancers when I was doing my medical school training here at OU, and then got to take care of a lot of these patients during my general pediatrics training in Dallas. During my second year of my training in Dallas, I decided this is what I wanted to do. Just kind of based on a lot of experience I've had with these kind of amazing kids and their families. You see what they go through, and then kind of the evolving science. I happened to be in a period of time where they were coming with a lot of new treatments and therapies, and there's been a lot of great strides. And I just felt called to be a part of that. And so I applied for a fellowship, which I was accepted to and stayed on in Dallas for 3 more years and finished my training there. And after I graduated, I came back to Oklahoma in July of 2010, and I've been here ever since. And in our division, I'm sort of our leukemia lymphoma expert, and try to focus a lot of my clinical work taking care of patients who have blood cancers, and try to go to national meetings to kind of stay up to date on the newest innovations in caring for kids who have blood cancers.
Wow, thank you so much. What an admirable man. Like, that's awesome. Julie, you want to go ahead?
So, another question we have for you is what are some of the major signs and symptoms that you look for in your patients?
Yeah, great question. So lymphomas in particular are a blood cancer of the lymph nodes. So lymph nodes, we all have hundreds of lymph nodes. A lot of them. You think about them in your neck, like if you get a cold or you get strep throat, those kind of glands in your neck, they get big and swollen. And most of the time they can get big for up to like a month or two after an infection, and then they should get smaller. And usually they don't get bigger than like a centimeter or so, like the size of like a small pea or a marble, and then should shrink. We get worried when lymph nodes get big and stay big for a long period of time. So like if you have big swollen lymph nodes for a couple of months, we worry when lymph nodes are kind of getting bigger and not shrinking, and also have a kind of feel hard and firm, where it's causing trouble, like kind of turning your neck or kind of shaking your head yes or no. We also kind of get worried when we see kind of big lymph nodes kind of like in the armpit or kind of near the collarbone, because those are not common areas where you get enlarged lymph nodes. And so when we see this kind of kids or young adults who have lymph nodes that are staying big for a long period of time, have that unusual kind of feel where they're hard and firm, or in unusual areas, then that's when we kind of get worried that maybe this is a lymphoma as opposed to a regular, what we call reactive lymph node, just getting big due to some sort of infection or inflammation.
Right. So when the lymph node doesn't go back down is kind of like a cause for concern.
Yeah.
Gotcha.
And as well, we also, know that with lymphomas, a lot of patients will have kind of other symptoms in addition to the lymph nodes being big. So kind of unusual fevers that just don't go away, that hang around for several weeks. They don't get better with like antibiotics. There's no they don't test negative for strep or for mono or for COVID. cause,
Mm-hmm.
and just kind of lingers. As well, a lot of lymphoma patients can have kind of unusual like weight loss, where you're just not trying to lose weight, but may find yourself kind of losing weight,
Mm-hmm.
feel very, very tired. May also kind of, in some lymphomas, also can kind of have like a lot of heavy sweating at night, where you're so soaked from sweating, where you like had to get up and like change your clothes or
Oh my
change your bed
goodness.
sheets, things
Yeah.
like that.
Gotcha.
Wow. I had no idea that like were like key like signs and stuff.
Mm-hmm.
Can fatigue as well be like a symptom or a sign?
It can be in some kids. It can really vary. Like I said, I've seen some kids who kind of have all those symptoms I talked to you about, and then there's been some who just had a lymph node that was just a little bit big for a little bit too long, or like
Okay.
a tonsil that was too big for a little bit too long, and they happen to get it looked at and removed and find out that it was actually lymphoma that was
Wow.
going on as opposed to infection.
Now, is that painful for these kids and adults?
So the lymph nodes in lymphoma, like when you touch them, like kind of usually like infected lymph nodes that have infection in them or are swollen due to an infection, are actually usually a little bit more tender and sore than lymphoma lymph nodes, because there's kind of something with that as they grow, they just don't seem to have the same kind of pain sensation. But they can get painful, especially if they get to be really large, and depending on the part of the body they are. Because it can then cause trouble with like I said, turning your head, turning your neck. If you get big lymph nodes in your tummy, you think about lymph nodes in your stomach
Mm-hmm.
and stuff, because look at there and they're so
Right.
deep you can't really feel them like you can do the ones in your neck or in your armpit or the groin area. But if you get big lymph nodes there, or the spleen, which is kind of
Mm-hmm.
like a kind of an organ part of the lymphatic system, if those get big, you can get tummy pain, trouble eating, because they kind of push on your intestines and your stomach.
Oh, ouch.
Yeah.
All right. Wow. Thank you so much for that answer. I'm going to go home and start feeling all over myself, like make sure I don't have any,
Mm-hmm. Right. Yeah.
just to make sure.
Mm-hmm.
Uh, what's the first thing you do upon diagnosis then?
Yeah. So whenever we see somebody who's sent to me for concern for lymph nodes, a lot of times they've gotten like an X-ray or an ultrasound or a CAT scan, some sort of picture that kind of tells us there are some lymph nodes that are big. If they haven't, then we typically, after we feel the lymph node, like we do an exam and we notice the lymph node if it's enlarged, and then find out a little bit more about what's been going on. If they haven't had CAT scans or things like that, then we may do those things.
Okay.
Ultimately, to know for sure what's going on, I talked to my friends who are pediatric surgeons to remove or biopsy one of these lymph nodes to take a look in there to see what exactly is really going on. Because, as I mentioned before, there's a lot of things that can cause big lymph nodes,
Mm-hmm.
and certainly even some unusual infections. Like, in Oklahoma, you think about like some of the ones that you can kind of get out, like, like from, like if you live out in rural areas where you're around like a lot of like frogs and ticks and other things, where you can get kind of infections that can cause weird lymph nodes. Things like tuberculosis can cause weird lymph nodes, and those are treated very differently than cancer. And so we want to get samples of the lymph nodes to find out for sure what exactly is going on. So we talk to surgeons to get us a sample of the lymph nodes,
Mm-hmm.
and then we can figure out the next steps in our plan.
Okay. Wow.
Gotcha.
Goodness.
Yeah. So, what's kind of the defining test that you do that kind of confirms lymphoma? Because I know there's different tests you run, and some of them just point to that as a possibility. But what's the one that kind of is like confirms that diagnosis?
Yeah. So while the CAT scan kind of guides is probably the biggest tool we use to guide us towards it,
Mm-hmm.
then the biopsy, we get out a piece of the lymph nodes, and they do special testing, what we call immunohistochemical staining, which is basically what they do is they look at the outside of these cells
Mm-hmm.
and see whether there's proteins and sugars and stuff that we know are associated with certain types of cancers that are there. And if they have a lot of the blood cancer markers or lymphoma markers, then we can tell that it's a lymphoma.
Mm.
And by the kind of special markers we see on there, then we can tell what type of lymphoma it is, because there are several different types of lymphoma, and they're treated differently. And so we use these kind of special testing to kind of further tell apart what type of lymphoma it is.
Gotcha. That makes sense. Oh, 100%. Yeah, that's interesting. Very interesting.
All right. Our next question is going to be, what's the most important thing you want people to know about lymphoma?
Yeah. So, in lymphoma in the kind of spectrum of childhood cancer is our third most common cancer that we see. Most common ones are kind of leukemias are our most common cancer. That's like about a third of childhood cancer. Then brain tumors as a group are another kind of 20%, and then lymphomas are about 10 to 15%. So
a good percentage.
So of childhood cancer. Now, cancer in children is still considered a rare disease compared to like in adults, where you see like lots of folks with breast cancer, colon cancer, lung cancer. In the U.S., we see anywhere from like around 16,000 new childhood cancer cases a year, and about 10 to 15% of those are lymphomas. Treatments for lymphomas in children are very, very effective, and the cure rates are well over 90%.
Nice.
In some cases, kind of approaching the high 90s. So these are very curable diseases with current treatment approaches. And we always want to continue to do better and make sure that we're coming up with treatments that kind of, our goal is to get 100% cure rate with the least side effects as possible.
Right.
And so that everybody is a long-term survivor and can have a long, healthy life, or as healthy as possible after they beat it.
Wow, thank you so much. That's a nice, positive answer to know that there is a cure, and like most of the time it is curable, which is awesome to know.
Is that survival rate, is that more in kids, or is it pretty optimistic for adults as well?
So, I focus on children, so I'll speak a little bit more on the children's side of it. In children, we typically see those kind of two big groups of lymphoma. There's Hodgkin's lymphoma, or Hodgkin's disease, and there's non-Hodgkin's lymphoma. Non-Hodgkin's lymphomas in kids, we usually see these kind of more aggressive, faster growing non-Hodgkin's lymphomas that are, even though that sounds very scary, more aggressive, faster growing, they're also more sensitive to treatment and shrink faster and go into remission more easily. In adults, there's a lot more kind of slower growing ones that are kind of a little bit trickier and harder to treat.
Gotcha.
Which is why the prognosis for kind of adult lymphomas lags behind the prognosis for children. As well, adults, we have more mileage on our tires, depending on whether you've got, problems with like high blood pressure, diabetes, smoking, or something else. You have a lot of other conditions that make it harder for the body to tolerate chemotherapy, radiation therapy, things like that that we use to treat most lymphomas. Kids, on the other hand, don't have that same wear and tear, the same kind of comorbidities there. Now, on the flip side, we have sometimes very young children who can be very sensitive to chemotherapy. And we have to be mindful of that and take special precautions in how we give these very powerful medicines that are needed to cure them, but doing it in a way that's safe to give to somebody who's very, very young.
That makes sense. Yeah, I didn't think about, you're right, like adults have, more wear and tear on their bodies, so of course it's going to be a different experience for them and everything. Yeah, that's interesting. Yeah.
How can we bring awareness to lymphoma when COVID is in the spotlight currently?
Yeah, sure. No, and I appreciate your all's efforts, and kind of doing what you're doing now.
Thank you.
Kind of, I think COVID's kind of overtaken the spotlight, and certainly, it still affects how we practice our care and taking care of our cancer patients, because, they can get sicker with COVID than other patients, and it makes it challenging to get some things done if you have a COVID infection, like because you need like sedation or things like that, where you want to be careful if you've got an active infection. I think the biggest thing is just to kind of share stories, and I appreciate y'all reaching out to some of our patients so they can share their stories of what's going on, just kind of remind people that, that these other diseases that we, are still been going on. They haven't taken a break. Unfortunately, during the pandemic, we had to put everything else on pause to keep sharing their stories, with your, with people with friends, with people who are thinking about, interested in looking for charities to donate. That that children with lymphoma, children are still being diagnosed with lymphoma, and we want to make sure we're giving the best care and to continue research to make sure that treatments that we're developing are going to have less side effects and continue to be very, very effective.
Mm-hmm. Yeah. So something we want to bring to light in our campaign is sort of like body awareness and being aware of symptoms early if they do arise. How important would you say early diagnosis is and being aware of the symptoms?
Yeah, it's a great question. It's a tricky one because there are some lymphomas that the lymphomas can, depending on which type it is, how you kind of feel and kind of how long it takes to get diagnosed can really vary.
Mm-hmm.
So Hodgkin's lymphoma or Hodgkin's disease is typically a slower growing and slower dividing type of lymphoma, where a lot of kids will have kind of swollen lymph nodes that are kind of there, just kind of slowly growing for like months before you kind of get worried, before they get worried or you mention it to a doctor or anything like that. The non-Hodgkin's lymphomas are more rapidly growing, and so kids often have a lot of these kind of notice these bumps getting bigger and bigger very, very quickly. Parents notice very, very quickly. So it can be it can be kind of a little bit variable. Now, we don't want everybody, being worried that they have to get a CAT scan every week.
Right.
They need to feel their neck every single day. Parents need to feel their kid's tummy every day to make sure they don't have a big spleen or anything like that. But a lot of we do kind of outreach and talk to our general pediatric colleagues out there to kind of talk to them, about kind of things to the education out there to try to help improve when you should have a kind of higher concern. I think families should be aware that the normal lymph nodes should get smaller after a couple of months, and if they're not getting smaller, if they're rock hard, if their kiddos losing weight or having unusual fevers, they're just kind of not to just chalk it up to the usual kind of viral illnesses that are always running around during the winter time, or always chalking up to strep throat or mono, especially if it's kind of lingering for a while, to be a little bit more kind of to ask some of those questions to their regular doctors, and we always want physicians out in the community. We're always happy to take phone calls from physicians in the community if they're at all concerned that a patient has lymphoma, to kind of talk to them about any blood tests they've done, any scans they've done, and to try to get them seen by us as soon as possible if there is a concern, so that we can make sure we're doing the right things to confirm the diagnosis and their concerns, or hopefully be able to also, in some of the cases, give a reassurance that this is probably just a lymph node from infection or big spleen from mono and not due to cancer.
Gotcha. Okay, so don't be over concerned, but definitely don't be too relaxed. Kind of a balance.
Yeah. I think to be concerned, knowing what the things to watch out for.
Right.
Everybody gets big lymph nodes in their life because everybody gets infections, but knowing when to get worried, the things to watch out for. Like I said, staying big for a long time, they're getting hard and firm, they're by your collarbone and the armpit, weird fevers, and they're not feeling like they normally feel with like a regular type of infection. And parents know their kids pretty well and are often very intuitive, for the most part, that they've had colds before. This isn't the usual. I'm worried.
Right.
And that's how a lot of our patients with cancer present. Is very astute parents and pediatricians who are like, nah, this isn't the usual stomach bug. This isn't the usual lymph nodes due to strep throat. This is something else.
Gotcha.
Okay, so definitely need to keep like an eye on people and like
Yeah.
an eye on yourself personally, especially even if like you were to get COVID or have lymphoma or cold or some kind of sickness in it, like this, it still continues on. Most definitely.
Yeah.
All right. Awesome. Well,
And cancers don't get better on their own.
Yeah.
So, if you've got, that's another kind of those things that, if lymph nodes get big and get small on their own, then it's most likely not a lymphoma.
Mm-hmm.
But the ones that bad things get worse if you don't do something about them.
you're right.
Gotcha.
Other things will get better often on their own, and that's another kind of things that a lot of we kind of notice that physicians are also very astute about and get worried when things aren't running their normal course that they should.
Mm-hmm.
Yeah.
Right.
I understand.
Yeah. That's like its defining factor. Like it's
Mhm.
not getting better.
Yeah.
Probably something to look more into. But
Well, Dr. Pochla, would you like to add anything else to this lovely podcast today?
Yeah, no, I appreciate you all taking the time to talk and kind of bring more awareness about lymphomas. Which, like I said, it's while cancer is a comparatively rare diagnosis in children, it is the leading cause of death by disease in children. So it's still a big area that we need to do better in treating.
Mm-hmm.
Currently we can cure overall we cure 80% of children with cancer. While that sounds like a great number when you compare it to adult cancers, for us it's still unacceptable because we want that to be 100.
Mm-hmm.
We want kids to grow up and live a healthy life and not have cancer and not die from cancer, of course.
Mm-hmm.
We've made a lot of progress in lymphomas, and we want to continue that progress to keep getting those cure rates to over 90% that are right now there, to keep on bringing those as close as we can to 100%, and to encourage people who are struggling with kind of what to do with like for if you're looking for charities to support, there's a lot of great charities out there like that help with pediatric cancer research and lymphoma research, like Cure Search, which works with Children's Oncology Group, the Leukemia and Lymphoma Society, that helps with research in both adult and pediatric cancers, the Alex Lemonade Foundation, St. Baldrick's Foundation, a lot of great charities out there that you can do to, if you want to know what can I do to help.
Mm-hmm.
There's still a big funding gap for childhood cancer research overall, and we still, even though we've been very successful, there's still a lot of room for improvement, because our goal is to try to get to 100%, and 90% isn't 100.
Mm-hmm.
So we all want to make sure we continue encouraging people to kind of help us get to our goal.
Yeah, for
Well,
sure.
Thank you, Dr. Pokala, for joining us today. We greatly appreciate you. Julie, would you like to add anything else?
Yeah, just thank you again for coming on. This was super informative, and I think we had a really great discussion. I hope our viewers learned something new. I definitely did.
Too.
So, yeah, thanks again for coming. We really appreciate it.
Yeah.
Oh, my pleasure. Anytime. Feel free. Glad that we can help spread awareness about lymphomas.
Definitely.
I appreciate you letting me share some of my insights on how we make these diagnoses and kind of the work we want to continue to do to cure everybody, especially children who have lymphoma.
Absolutely. Thank you again.
Thank you so much.
Have a great week.
Welcome. You too.
Thanks. All right, friends. Make sure to tune in next week. We're going to be releasing podcasts twice a week, Mondays and Fridays. Also, make sure to check out our social platforms, Breaking Down Lymphoma. Anything else, Julie, you'd like to add?
Yeah, so here's our logo, Breaking Down Lymphoma. You can find our socials at this name on Twitter, Facebook, and Instagram. We'll also be releasing our podcast on YouTube under the same name. So be sure to check those out. Yeah, we hope you learned something today. I definitely did.
Me too.
So yeah, just remember, be aware of those symptoms. Now you know the symptoms, so just, be aware of them. Take care of yourselves. And tune in next week for our next guest. Thanks for tuning in.